based on my experience and the experience of the Dr. Prabhat Samant, which is a published study. In Indian scenario, alcohol cannot be attributed as cause of pancreatitis. There are many things which can damage. There are drugs who can affect pancreas. Even the quantity matters, combination matters. There are different medicines in any system, in Ayurveda, allopathy, Unani, homeopathy. If they are not given properly or given overdose or wrong combinations, they can also affect pancreas. Once there is a pancreatitis, any type of alcohol is bad. People say that if you remove the gallbladder, pancreatitis will not come. But chronic pancreatitis is a progressive disease which shortens the lifespan of a person, and depending on the type of pancreatitis, nearly 20 to 55% patients develop cancer in their lifetime. Unfortunately, there is a tag of alcohol with the incidences of pancreatitis, but it is not so true. The disease came from the West, and this is based on the studies carried in the West. But a study carried in Bombay and published by Dr. Prabhat Samant, a noted gastroenterologist, she has clearly mentioned that in Indian scenario, the chronic pancreatitis is called tropical chronic pancreatitis, where alcohol is not attributed as the cause of cancer. And what she found, protein malnutrition and mineral deficiency are the major cause of pancreatitis in India. And in adding to that, our own findings at Padav in last 30 years or more, we found that hardly 5% patients are those who are regular alcohol taker, 66% are those who never took it, and 20% are occasional. So alcohol and pancreatitis, it is coming from generation to generation, and in medical world, whenever a patient comes, even for 12 years or 13 years, girl and boys, doctor unnecessarily ask, do you have a history of alcohol? But I, based on my experience and the experience of the Dr. Prabhat Samant, which is a published study, in Indian scenario, alcohol cannot be attributed as cause of pancreatitis. There are cases who have gallstone and developed acute pancreatitis, but the number of cases who never had gallbladder stone and developed acute pancreatitis, so it is a myth, but it is present in some cases. I don't think spicy food can damage the pancreas. Rather, I will say no food can damage more it, because people have habit of skipping food. So it is not spicy food alone. There are many factors, but yes, food plays an important role, and no eating, irregular eating, untimely eating, wrong combination, wrong quantities, they are basic cause toward the causing pancreatitis. No, it is true that pancreatitis is more among men, but if there is a 3 men, there is a 1 woman. So it is a male dominant disease, but female also have pancreatitis. Again, initially the onset of disease, as I quoted the paper of Dr. Prabhat Samantji, that in Indian scenario, the average age of the disease was 24 years. But in current years, because that study was done, I think 20 years back. But what we are seeing here, that it is coming more and more to the young people, even the children. So there are people who are under 11, and maximum they are 18 to 24 or 16 to 24. So disease is more prevalent among young population than the elderly population. Smoking is bad for the body, but in our study we found only 15% patients who were diagnosed of different types of pancreatitis, only 15% had a history of tobacco, 85% non-tobacco. So it will be very difficult to say that tobacco may be the cause of pancreatitis. There are different perception about it. Some people say 24 point in a month, it is safe. Some say 14 point in a month in a safe. And there are many people who take it daily and they remain healthy. So I think it depends on the individual capacity of drinking and absorbing. Many people, there are few people who cannot digest at all. And there are people who can digest one bottle every day and taking it for 20 years. So Satme, Ayurveda says they have Satme. Their body is used to that. So I should not comment about it, that what is safe, what is not safe. It is individual choice and they should check themselves what is good and bad for them. Once there is a pancreatitis, any type of alcohol is bad. Yes, triglycerides is a part of fat metabolism. So it is indicative that fat metabolism in the body has distorted and pancreas plays key role in fat metabolism. So there is a linkage, but if it is high, that means something has happened. So that has to be explored. But there are other factors also for triglycerides. One is genetic, one is obesity, one is eating habit. So that's like, yes, there are studies that if you take more calcium, it can be, but it is not proven yet. There are many things which can damage. There are drugs who can affect pancreas. So even the quantity matters, combination matters. So there are different medicines in any system, in Ayurveda, allopathy, Unani, homeopathy. If they are not given properly or given overdose or wrong combinations, they can also affect pancreas. Now, there are patients who have autoimmune disease, autoimmune pancreatitis. We have seen it, and we are very happy to say that this sort of pancreatitis is also curable at Padav. Any disease can be triggered off. Suppose there is a fever and there is an inflammatory process going on in the body, it can trigger, but it cannot cause pancreatitis. If there will be injury, definitely it is going to cause something, not necessarily pancreatitis, but injury-induced diseases are well reported. I can't give you the number, but there are cases who had trauma and that developed pancreatitis. No, this is a wrong perception. We have last year published a data on 182 genetic pancreatitis patients who have hereditary positiveness as per the classification. So it is again a myth. Hereditary pancreatitis is very common and more cases are coming. I think due to the advancement of diagnosis, diagnostic tools, we are able to diagnose more accurately what type of pancreatitis it is. People say that if you remove the gallbladder, pancreatitis will not come. But in our practice, which is scattered over 3 decades, we have seen the patient develop pancreatitis, then they were identified for a gallstone. Doctor said remove it, they remove it, and they remain well for maximum for 2 years, and then they again started getting it. So I say even if one person get it, that means there is a question mark. So it is not the only cause. Yes, gallbladder stone might be, so gallbladder physiology might play an important role towards the cause of pancreatitis. So if gallbladder is functioning well, if it is contracting well, based on my personal experience, I can say there can't be any pancreatitis. But we are not doing anything to continue with the normal contracting of gallbladder. And they say stress and fasting is a major cause of affecting contracting of gallbladder. And if there is no contraction, then fluid will not come out. This will form sludge, and the sludge will form stone. So this is a chain, and once there is a stone, it will not contracting properly. So our body will need more alkaline agent to neutralize acid-alkali balance at the duodenum level. So that plays important role when gallbladder is not working. So, but if a patient continue to keep taking care of their functioning of gallbladder, I doubt that person will ever have pancreatitis. Yes, you should say type 2 diabetes. I will say it is not related. But there are patients who had pancreatitis and pancreatitis induced diabetes is there. And that in that time, some patients feel better and sometimes damage is so much that they have to take anti-diabetic treatment for their whole life. Chronic pancreatitis is a progressive disease which shortens the lifespan of a person, and depending on the type of pancreatitis, nearly 20 to 55% patient develop cancer in their lifetime. So pancreatitis can be a precursor of pancreatic cancer. Now, it can be on the left lumbar region but radiated to back. So starting from the epigastric region, going towards left lumbar and back, it is the classical symptom of pancreatitis, but there are cases who develop nothing, but they still diagnosed for chronic pancreatitis, maybe incidental checkup or incidental discovery. Pancreatitis is a self-limiting disease. If there is an attack, it will be inflammation. And if a patient takes complete rest and eat nothing, the attack will subside. But there is no guarantee if the attack has subsided, the person will not get attack again. Yes, these are the symptoms which can be present in many conditions in the abdomen. That's why pancreatitis should be diagnosed by a competent gastroenterologist who is not well versed with the pancreatitis, but he should know other diagnosis of the abdominal cavity. No. Pancreatitis is a disease of variable characteristic. There is no similar characteristic you will find. Some patient may feel extreme pain, some people may feel dull pain, especially in chronic pancreatitis, and some cases they cannot feel any pain. So depending on the functioning of the pancreas, so hard and fast rule cannot be applied in pancreatitis patients. Our body is well designed to digest fat, carbohydrate, protein, vitamins, minerals. But in pancreatitis, there is a fecal elastase test which tells about the exocrine deficiency. And if it is so, then patient will not able to digest fat. So pancreatitis and loose motion or fat in the stool is closely linked. Yes, because once a child gets pancreatitis, there will be restrictions on eating, restrictions on the lifestyle. So in the growing period, he is not able to take that nourishment which is required for the body. That is one cause. Second thing, periodical attacks. It keeps on coming. So it is bad for the patient. Pancreatitis is a debility causing disease, and it affects physical, mental and financial health of a person. So once a patient gets pancreatitis, he has to go into trauma until unless they get clue about the Padav where we are treating pancreatitis very successfully. So then patients are back in normal life. But otherwise, pancreatitis remains is incurable and affects a person's life very badly, personal, professional and emotional. Yes, there is a tag about the pancreatitis. It is non-curable. There is no cause for dawn. And second thing, unpredictable nature. So I will not blame a patient and their families because they don't know what to do. So once such situation comes, the best thing is kill yourself. Suicidal tendency is part of that. Patient always say, why me, why me, why me?